Mallory Weiss syndrome. Introduction. The original description by Mallory and Weiss in 1929 involved patients with persistent retching and vomiting following an alcoholic binge. However, Mallory-Weiss syndrome may occur after any event that provokes a sudden rise in the intragastric pressure or gastric prolapse into the esophagus, including antecedent transoesophageal echocardiography. Severe and prolonged vomiting can result in tears in the lining of the esophagus. Mallory-Weiss syndrome, MWS, is a condition marked by a tear in the mucous membrane, or inner lining, where the esophagus meets the stomach. Most tears heal within 7 to 10 days without treatment, but Mallory-Weiss tears can cause significant bleeding. Depending on the severity of the tear, surgery may be necessary to repair the damage. Definition. Mallory-Weiss syndrome is characterized by upper gastrointestinal bleeding secondary to longitudinal mucosal lacerations, known as Mallory-Weiss tears, at the gastroesophageal junction or gastric cardia. Incidence. Mallory-Weiss tears account for an estimated 1 to 15% of cases of upper gastrointestinal bleeding. Although the age range varies widely, affected individuals are generally in middle age, 40s 50s, and men reportedly have a higher incidence than women by a ratio of 4:1. Causes. The most common cause of MWS is severe or prolonged vomiting. While this type of vomiting can occur with stomach illness, it also frequently occurs due to chronic alcohol abuse or bulimia. Other conditions can result in a tear of the esophagus, as well. These include trauma to the chest or abdomen, severe or prolonged hiccups, intense coughing, heavy lifting or straining, gastritis, which is an inflammation of the lining of the stomach, hiatal hernia, which occurs when part of stomach pushes through part of diaphragm, convulsions. Receiving cardiopulmonary resuscitation, CPR, can also lead to a tear of the esophagus. Symptoms. MWS doesn't always produce symptoms. This is more common in mild cases when tears of the esophagus produce only a small amount of bleeding and heal quickly without treatment. In most cases, however, symptoms will develop. These may include abdominal pain, vomiting up blood, which is called hematemesis, involuntary retching, bloody or black stools. Blood in the vomit will usually be dark and clotted and may look like coffee grounds. Occasionally it can be red, which indicates it's fresh. Blood that appears in the stool will be dark and look like tar. There are other health problems that may produce similar symptoms. Symptoms associated with MWS may also occur with the following disorders. Zollinger-Ellison syndrome, which is a rare disorder in which small tumors create excess stomach acids that lead to chronic ulcers. Chronic erosive gastritis, which is inflammation of the stomach lining that causes ulcer-like lesions. Perforation of the esophagus. Peptic ulcer. Boer-Weiss syndrome, which is a rupture of the esophagus due to vomiting. Diagnostic evaluation. The doctor will take history about any medical issues, including daily alcohol intake and recent illnesses, to identify the underlying cause of symptoms. If symptoms indicate active bleeding in the esophagus, doctor may do what is called an esophagogastroduodenoscopy, EGD. Client will need to take a sedative and a painkiller to prevent discomfort during this procedure. Doctor will insert a small, flexible tube with a camera attached to it, called an endoscope, down esophagus and into the stomach. This can help doctor see esophagus and identify the location of the tear. Doctor will likely also order a complete blood count, CBC, to confirm the number of red blood cells. Red blood cell count may be low if client has bleeding in the esophagus. Doctor will be able to determine if client has MWS based on the findings from these tests. Management. According to the National Organization for Rare Disorders, the bleeding that results from tears in the esophagus will stop on its own in about 80 to 90% of MWS cases. Healing typically occurs in a few days and doesn't require treatment. But if the bleeding doesn't stop, you may need one of the following treatments. Endoscopic therapy. Client may need endoscopic therapy if the bleeding doesn't stop on its own. The doctor performing the EGD can perform this therapy. Endoscopic options include injection therapy or sclerotherapy, which delivers medication to the tear to close off the blood vessel and stop the bleeding. Coagulation therapy, which delivers heat to seal off the torn vessel. Extensive blood loss may require the use of transfusions to replace lost blood. Surgical and other options. Sometimes, endoscopic therapy isn't enough to stop the bleeding, so other ways of stopping the bleeding must be used, such as laparoscopic surgery to sew the tear closed. If client can't undergo surgery, doctor may use arteriography to identify the bleeding vessel and plug it to stop the bleeding. Medication. Medications to reduce stomach acid production, such as famotidine, Pepcid, or lansoprazole, Prevacid, may also be necessary. However, the effectiveness of these medications is still under debate. Preventing Mallory-Weiss syndrome. To prevent MWS, it's important to treat conditions that cause long episodes of severe vomiting. Excessive alcohol use and cirrhosis can trigger recurring episodes of MWS. If client has MWS, avoid alcohol and talk to doctor about ways to manage condition to prevent future episodes.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.